streetwise understanding of cryptic pregnancy. I call it streetwise because it is being used in the streets by scammers to scam some women. Please talk about cryptic pregnancy. So today we are going to look at this question, cryptic pregnancy, what it is and how it does manifest, and maybe some other risk factors that can make you to have cryptic pregnancy. So what is cryptic pregnancy? Cryptic pregnancy is a condition where a woman is pregnant, but she is unaware that she's pregnant until into the late gestation. Maybe from 20 weeks upwards, the woman might not know that she's pregnant, and some cases it might even get to the point of delivery. When the woman now knows that she's pregnant, she might even come into a labor ward with pelvic pain, not knowing that it is labor that she's in. That is cryptic pregnancy, but it does occur very rarely. It is not common. So the occurrence rate is 1 out of 475 pregnancies will go undiscovered till around 20 weeks of gestation. That is around 5 months of pregnancy, but you're not aware. Then 1 in 2,500 will even progress till delivery before the woman is aware that she's pregnant. Cryptic pregnancy is also called stealth pregnancy or denied pregnancy because you are in denial. You won't even believe and accept that you are pregnant. Yeah, it's denied pregnancy or stealth pregnancy. So in most cases, the woman doesn't know that she's pregnant because she doesn't have the pregnancy symptoms. So there are things that can make someone have cryptic pregnancy, and then we'll go into them one by one. And number one, recent deliveries. Recent deliveries in aspect that after a woman gives birth, she's expecting not to carry a baby. She's expected not to take in because of lactational amenorrhea. So when the woman is not practicing exclusive breastfeeding as it should, the condition is not met, and then lactational amenorrhea might not be optimal, and the woman can take in, and still she wouldn't know because she wouldn't be also expecting her period to be around that time. So she might be pregnant for the first month, second month, third month, fourth month, and sixth month, not knowing that she's pregnant because she wasn't expecting her period to be on at that time. Irregular period. Now, people who have irregular periods, they are becoming used to not having their period come at a regular point in time. So at times they be carried away. Even when they don't see their period, they will think that, oh, it is still gonna come, as they have been used to that. So at a point they will be pregnant, but they don't know that they are pregnant, and then this continues for some time. Number 3, failed birth control. You know, a lot of options for contraception are out there, but they have different failure rates. And I don't know if you know that they can fail. Yeah, they can fail, but they have different failure rates. So if you want to apply contraception, if you want to make use of any contraception, please get well informed and then choose the right method for you. Now, when your contraception fails, you might not know that it has failed, because most of this contraception, they work by inhibiting ovulation. Therefore, you don't menstruate. So while you are not menstruating, you will be thinking that you are on a contraceptive method. Therefore, you shouldn't menstruate. Meanwhile, at that point, you are pregnant. You are pregnant. So even to think about the pregnancy symptoms, that even in some cases you might even have the pregnancy symptoms, but it will not be clear to you that you are pregnant because you are already attributing your amenorrhea to the contraception that you are on, which has failed. So failure of contraception is one of those things that can make a woman to have cryptic pregnancy. Now, first-time moms. First-time moms, they are inexperienced moms, inexperienced of pregnancy symptoms, not so much aware of what those symptoms seems to be. Therefore, they are prone to cryptic pregnancy. Note that these signs, they may be having it at a later stage in the pregnancy. It doesn't mean that it doesn't come at all, but it comes at a later stage because they are not aware. They are not used to it. They can't detect it. It's already there, but they can't detect it. They can't pick it up at that early stage. Therefore, the pregnancy might go on for a longer time before they can actually detect that these are pregnancy symptoms, and then go for checkup and some tests to confirm that they are pregnant. So 2 bonus points here that will make a woman to be at risk of cryptic pregnancy. Number 1 is when there is Misinterpretation of implantation bleeding. Implantation bleeding, I have mentioned this a lot in my videos. You can go and check. When a woman has implantation bleeding misinterpreted as a light period, wow, this woman is already pregnant and the fetus has implanted in the womb, but she's interpreting that bleeding as light period, but she's already pregnant. So this can lead to cryptic pregnancy. Yeah. Then lastly, false negative pregnancy test. When pregnancy test is not carried out properly at home, it can give you a false negative result. False negative means that it is negative but it's not actually negative because your result is false, but the actual thing should be true. So it is false negative tests. When this happens, you won't believe that you're pregnant because it is not positive, but the baby still grows. So that is risk factors of a cryptic pregnancy. Now, there are other aspects of cryptic pregnancy, streetwise understanding of cryptic pregnancy. I call it streetwise because it is being used in the streets by scammers to scam some women, telling them about cryptic pregnancy, cryptic baby. Some even call it critical anyway. So if this is what you want me to tell you when you ask this question on cryptic pregnancy, please indicate in the comment section if you want to know about these scammers and what they do with this term cryptic pregnancy, so you don't get scammed, you don't get defrauded, and you don't carry someone's baby